Hello and welcome to our International Health Professional Solution. My name is Lauren Sauerbeck. As a health professional or distributor choosing to work with health professionals in the implementation of wellness solutions, it's essential that you know a few core concepts to support your success. Understanding these concepts will help you with effective communication and an efficient implementation. This information is important for all decision makers within a healthcare practice, the lead point of contact, and of course the distributors supporting health professionals. The first concept we will discuss is wellness. From the patient perspective, wellness begins with helping them understand that the choices they make impact how well they feel. With that, we look toward a wellness maintenance solution. As you know, we need essential nutrients on a daily basis, and due to poor dietary choices and the decline of food quality, it's rare these days to be getting all of the essential nutrients from our food. By helping patients get on an ongoing wellness maintenance solution, the patients understand what nutrients they need and can reorder their wellness supplies each month or as needed. With patients on a successful wellness maintenance plan, health professionals can work with their patients to further customize each patient's wellness plan to help guide them towards their own wellness goals. As the number of patients staying on a wellness plan continues to grow, we then begin achieving financial wellness for the practice. We all can acknowledge that a healthcare practice is very busy, and we can acknowledge that any program implemented must generate revenue to be worth its time. We can achieve the needed revenue goals efficiently by simply answering patient health questions with wellness maintenance plans that match their wellness goals. With that, we deliver wellness for the patients and wellness for the practice. Our next core concept is mission, vision, and why. This is a very important key to successful implementation for several reasons. The first reason is that staff members and colleagues can be resistant to change, especially if they don't know why changes are happening. This is easily solved by establishing a vision and communicating it to those who understand. The first conversation starts with the health professional or top decision makers of a practice. For a health professional, if you haven't yet done so, imagine your practice a few years ahead, providing the patient care that you want to provide, attracting the patients you want, and generating the revenues you need. Once you have a solid vision of what you want, then craft it into a statement. This statement can be displayed around the office, and we suggest communicating it to the staff. In fact, if the staff members can integrate the concept into how they answer the phones, you can attract new patients looking for wellness care from their health professionals. Make sure to read this section in your guide for many more important tips. Our next core concept is a discussion on competitive differentiators. Our first reference to this is in our products and services. There are many areas where we as a company can deliver what other companies cannot deliver. With this, our competitive differentiators are the unique factors that stand out against other companies. The same concept applies to our health professionals. The solution and services you offer to support your patient wellness care will make your practice stand out from other practices of the same specialty, and with that, attract new patients who want the advanced care you're giving. By simply embracing the strengths and the differences, you can set yourself apart from your own competition and build the vision you want to create. Our next core concept is 80% small, medium, and large. The purpose of this discussion is to understand how to streamline a successful implementation and provide solutions that match patient demographics. First of all, the 80% rule refers to the primary need of a practice. For example, if we ask you a question, what are the most common health challenges that you see with the patients as you support? Whatever the most common condition is, that is the primary patient need, and with that, the primary focus for our implementation. Secondly, we will recognize that patients have different levels of education, budget, and commitment to their wellness plan. The concept of small, medium, and large here gives health professionals an easy way to meet patients where they are. For example, a small package could be as simple as a single multivitamin, omega-3 or an activated B complex, or an OPC3. A medium package could be a multivitamin and B complex combination, or a multivitamin B complex and calcium combination. A large package could be a daily essentials kit plus omega-3, or perhaps an optimal wellness package that includes a multivitamin, B complex, and omega-3 product. By having less expensive or more comprehensive solutions, we can meet the needs of each patient. As a special consideration, as patient education on their wellness increases, so does their commitment to their health and the budget they're willing to allocate to their wellness. Moving forward, our next concept to support successful implementation is Phase 1, 2, 3. This is a simple means to organize in order of priority, to do so without overwhelming the staff. In Phase 1, we implemented the first priority with initial products, which would be those determined by the 80% rule or primary need of the practice. Also in Phase 1, we focus on helping get a successful system running. Once Phase 1 is working properly, we're ready for Phase 2, which is simply the process where we add products one or two at a time. Since a system is already in place, adding products becomes easy. Once all the products a health professional wants are in place, we can then look at Phase 3. Phase 3 is where we may implement a customized solution or support referral marketing or advanced business development. Please see your guide for many more details on this concept. Our final core concept for this discussion is on continuing your education. Whether you are a distributor working with health professionals, a health professional, or a staff member, continued education is essential to your success. As a simple tip, learn one product a day by reviewing everything available on each product. With one per day accomplished, product knowledge moves very quickly. Also search through the downloads, meeton.com, unfranchisetraining.com, and other opportunities to continue your education. We are committed to your success, and these concepts help form a solid foundation for a practice of any size or specialty. Be sure to watch the Wellness Goals video and review your HP implementation guide from cover to cover.